Hey everyone, and welcome to today's Explainer. We're diving into a topic that literally affects almost all of us as we get older, but it almost never gets the spotlight it truly deserves. We're talking about how seemingly safe everyday medications can unexpectedly put a massive strain on an aging heart. Trust me, this is absolutely crucial information that might just change the way you look at your medicine cabinet forever. So let me ask you this. Have you ever grabbed a pill, maybe something you've taken 100 times, thinking it was completely harmless, only to find out it was actually putting extra stress on your cardiovascular system? If you're over 60 or if you're caring for someone who is, this is an assumption we absolutely have to challenge right here, right now. Today, we are breaking down 5 everyday medications that can quietly turn into hidden heart risks as we age. We're going to explore why this happens and exactly what you can do to protect yourself. Oh, and you're definitely going to want to stick with me until the end, because the 5th medication on our list, it's a real shocker, and it's probably sitting right there in your home right now. Okay, let's dive right in. To understand why this happens, we have to look at the biology. Picture your body at age 40. Your liver and kidneys are these highly efficient processing machines, and your heart is super resilient. But fast forward to age 65 and beyond, well, our bodies just process things differently. The liver and kidneys might work a little slower, and the heart becomes significantly more sensitive to certain chemicals. The medication itself hasn't changed at all, but your body's response to it fundamentally has. First up on our list, medication 1, NSAIDs or pain relievers. We're talking about the heavy hitters here. Ibuprofen, naproxen, the stuff we all reach for when arthritis flares up or our back aches. Now, they are incredibly effective for their intended job, which is pain relief. But they come with some sneaky hidden risks. They can actually cause your body to retain extra fluid and drive up your blood pressure. And that extra fluid doesn't just sit there doing nothing. It literally forces your heart to work much, much harder to pump blood. If you're already managing heart disease or high blood pressure, this extra workload is a serious red flag. And that brings us to a really dangerous misconception. A lot of people think, hey, many people assume that because these medications are sold over the counter, they must be completely harmless. Honestly, scratch that. It's a massive, dangerous myth. Even non-prescription medications can have a profound, powerful impact on your heart. Moving right along to medication 2, decongestants. These are your go-to remedies for when you've got a stuffy nose from a cold or the flu. They usually have ingredients like pseudoephedrine. Here is exactly how they do their job. Step 1, they narrow the blood vessels to shrink swollen tissues in your nose. But wait, there's a catch. They don't just stay in your nose. Step 2, they narrow blood vessels system-wide, which spikes your overall blood pressure. And step 3, they make your heart beat faster. For a younger person, maybe no big deal. But if you're over 60 with any history of heart issues, this whole chain reaction is something you really want to avoid. What a lot of folks just don't realize is that a simple cold medicine from the corner pharmacy can dangerously interact with prescription heart medications. It can even trigger unwanted cardiovascular events. You always need to read those labels carefully and check in with your healthcare provider to find a cold remedy that won't mess with your heart. Next up is medication 3, sleep aids. Look, we all know how incredibly frustrating it is when you just can't sleep. It drives so many older adults straight to over-the-counter sleeping pills. But relying heavily on these nighttime meds brings up a whole host of secondary issues. We're not just talking about waking up a little groggy. We're talking dizziness, confusion, sudden drops in blood pressure, and even rhythm changes in your heart. Plus, they massively increase the risk of taking a dangerous tumble if you have to get up in the middle of the night. So instead of just slapping a chemical Band-Aid on the problem, a Band-Aid that strains your heart, by the way, we really need to shift in perspective. We need to treat the root cause. Are you dealing with sleep apnea, high stress, maybe just some poor sleep habits? Or could it be a side effect from another pill you're taking? Fixing the actual root issue improves your sleep without making you dependent on stuff that stresses your cardiovascular system. Okay, let's talk about medication 4, certain diabetes medications. Let me be absolutely, emphatically clear right out of the gate. Treating diabetes is a must. Leaving it uncontrolled will seriously damage your blood vessels and your heart. But the specifics of the treatment really matter here. Some of the older diabetes medications actually carry risks like fluid retention, weight gain, or effects that can worsen heart failure in certain people. But contrast that with modern medicine. We now have incredible new diabetes medications that actively offer heart protection while they lower your blood sugar. It's a real game changer. The big takeaway here? Treatment has to be deeply personalized. Just because a specific pill works wonders for your neighbor doesn't mean it's the right choice for you. Having regular check-ins with your doctor ensures you're on the exact treatment that fits your specific heart and your overall health profile safely.
And now we've made it to Medication 5, the surprising stomach pill.
This is the one that literally drops jaws when people learn about its hidden cardiovascular impact. It's so mundane, so incredibly common, it's probably sitting in a cabinet right down the hall from you. Yep, antacids, the everyday stuff we pop for heartburn and acid reflux. While they seem completely harmless beneath the surface, they can sometimes affect the heart indirectly in ways you'd never expect. Let's peek at the internal chemistry for a second. Some of these antacid products are actually packed with surprisingly high amounts of sodium, which, as we know, directly contributes to fluid retention and high blood pressure. Others can completely throw off your body's mineral levels over time. And minerals like magnesium and potassium, they are literally the conductors of your heart's electrical system. When they get out of whack, a disrupted, irregular heartbeat is a whole lot more likely. Now, let's be clear, popping a single antacid after a spicy taco isn't the problem here. The daily use danger is the real issue. The true cardiovascular concern pops up when people use these products daily, for months or even years, without ever running it by their doctor. It's that unsupervised chronic use that slowly and quietly builds up the risk. So, how to protect yourself? We've gone over a lot of hidden risks, but I definitely don't want you leaving this feeling anxious. Instead, let's shift gears and look at how you can actively protect yourself. Here is how you build a rock-solid, proactive game plan. Step 1. Never, ever stop taking a prescribed medication on your own without talking to your doctor. Step 2. Keep a super accurate, updated list of everything you take, and yes, that includes vitamins and over-the-counter stuff. Step 3. Schedule regular medication reviews with your doctor or pharmacist to catch any weird interactions. And Step 4. Actively watch out for warning signs. And what exactly are those warning signs? You need to keep an eye out for unexplained swelling, feeling short of breath out of nowhere, a rapid or fluttering heartbeat, dizzy spells, or sudden weird spikes in your blood pressure. If you notice any of these, please don't just brush them off as getting older. That's your heart's way of raising a flag and asking for help. Guys, your heart works tirelessly for you every single second of your life. The choices you make, right down to the over-the-counter pill you grab for a random headache, impact its long-term health. But look, you are now equipped with the knowledge to make better choices. Don't just assume a medication is safe because it's common. Stay informed, ask your pharmacist questions, and always be an advocate for your heart. I want to leave you with this final, provocative thought. Have you ever been totally surprised by a medication's side effect? Take a few minutes today to pull out your own medications, review them with everything we just talked about in mind, and maybe schedule a quick chat with your doctor. Thank you so much for joining me for this explainer. Stay informed, stay proactive, and take really good care of your heart.